visualization. Sanitize my hands quickly. Okay, hi, my name is Candace, and I'm your student nurse from the University of Florida. Can you tell me your name and date of birth?
Yes, my name is Lady Wong, August 24, 1994.
Okay, now can you tell me the date and your reason for this visit?
It is July 31st, 2016, and I am here for a physical.
Okay, what is your pain level at this time? Zero being no pain and 10 being the worst pain possible. Zero, okay. So, Lady is a 21-year-old female, and she is well-nourished and well-developed, and she appears her stated age. She's well-oriented and alert, cooperative, no signs of acute distress. Her appearance, behavior, and speech are appropriate, and her recent and remote memory are intact. So now I'm going to test your vitals, okay? So your radial pulse in your left arm is 70 per minute. Your right arm is 71. Your respiration are 18, and your breathing is relaxed and effortless. Your temperature is 36.8 degrees Celsius, and your blood pressure on your right arm is 118/78, and on your left arm is 116/79. Okay, so right now I'm going to test your vision using this color chart. So please stand up and cover your right eye, and maybe the smallest line possible of your left eye. Okay, good. Switch your eye. Okay, you can see it. So you have 20/20 vision. That's very good. So now I'm going to inspect your skin using. So your skin is pinkish tan, consistent with genetic background. So I'm going to palpate your skin bilaterally with the back of my hand to assess for your temperature. Okay, the skin is warm to touch with equal temperature. It's moist and well hydrated. Your texture is smooth and firm with an even surface. Tartar is good. No tinting or lesions present. Can you check your capillary refill? Okay, nail buds are pink, and the capillary refill is less than 2 seconds. So I'm going to check your hair. Okay, it's thick and it's fine. Sorry, it's thick and it's distributed evenly. It's appropriate for age and it's shiny, and your scalp is clean and free of lesions. Okay, your skull shape is monocephalic, no lumps or lesions. I'm going to palpate your forehead. Do you feel any tenderness or pain? Do you feel any tenderness or pain when I palpate your maxillary sinuses? Okay, so I'm going to place my hands on your temporal mandibular joint, and I want you to open and close your mouth. Okay, smooth movements and no crepitation present. Okay, can you use facial movements for me? I want you to clench your teeth, close your eyes, wrinkle your forehead, raise your eyebrows, smile, stick out your tongue, puff out your cheeks. Okay, good job. Cranial nerve 5 and 7 are intact. So I'm going to use this piece of paper to touch your face, and I want you to tell me when you feel a movement by take down. Okay, your light sensation abilities are intact. Now I'm going to inspect your nose. I'm going to use this pen light, okay? Okay, so your nose is symmetric in midline and proportions to your facial features. Your turbinates and nasal mucosa are red, and your mucosa is smooth with a moist surface. So I want you to plug your nose with your right hand, your right nostril, and breathe in. Now, do your left nostril, breathe in. Okay, patency of nostrils are present. So I'm going to test your vision with this chart. It's a smaller chart. So I want you to cover your right eye and read the smallest line possible. Okay, cover your left eye and read the smallest line possible. Okay, so patient has 14/14 near vision using the Rosenbaum chart. So I'm going to examine your eyes. So your eyebrows are present bilaterally, they move symmetrically, and as expressions change, they also change. No scaling or lesions. The skin of your eyelids are intact with no redness or swelling, lesions or discharge, and your eyelashes are evenly distributed. Okay, I'm gonna pull your eyelids down. Can you look up, please? So your eyes are moist and glossy. Your conjunctiva is clear over the lower lids. White over the sclera, no lesions or swelling present. So can you focus on the board, please? cover your right eye and tell me when you see my wiggling fingers coming to view. Okay, your peripheral fields are intact. Look at the board and tell me when my fingers coming to view. No nystagmus present, parallel track. Okay, so I'm going to shine this light in your eye. So your optic disc is creamy and it's yellow-orange with a round shape. Your retinal vessels have a paired artery and the vein pass to each quadrant. Your fundus is light red with no lesions or obstructing obstructing the retinal structures, and your macula is 1 disc diameter in size. Now I'm going to examine your eyes, your ears, excuse me. I'm going to palpate your auricles, okay? So you feel any pain or tenderness? Okay, so your ears are equal in size bilaterally. Your skin is intact, no lumps or lesions. So I'm going to ask you to put your finger in your ear and I'm going to whisper some words to you, okay? Cat. Cat.
Cat, dog, dog.
Okay, I want to do cover your left ear now.
John, boy, happy.
Okay, good. Okay, so now that means your cranial nerve 8 is intact. So I'm going to look inside your ear, okay? Okay, so your tympanic membrane is shiny and translucent and it's fairly gray color. Cone-shaped light reflex is prominent at 5 o'clock in your right eardrum and 7 o'clock in your left eardrum. So I'm going to, can you hear better in one ear than your other ear?
Yeah.
Okay, so now I'm going to inspect your mouth, okay? So your lips are moisturized. Your upper and lower jaw are lined. Your gums are pink. Spit out your tongue, please. Okay. No lesions are present on your tongue. Your tongue is midline. No nodules or ulcerations. Your pupil mucosa is smooth and pink. Your palate is white with a regular transverse rugae on anterior and posterior, and it's pink and smooth. Can you say ah? So your uvula. Okay, so your uvula and soft palate rise midline, and your tonsils are pink with a 1+ grade. Can you test your gag reflex? Okay, your gag reflex is present. So I'm going to palpate your neck, okay? Okay. So your head is midline, erect, and your accessory muscles are symmetric. So I'm going to palpate your carotid pulse now, okay? I'm going to make sure to do one at a time so you don't pass out. Okay, so your pulses are moderate and equal bilaterally with a grade of 2+. So I'm going to also palpate your carotids now, okay? Okay, so there are no bruits in your carotid. There are no bruits, okay? So we're going to test the range of motion of your neck. So I want you to tilt your head down, now tilt up, tilt your head to the right, turn your head to the left, turn your ears towards your shoulder, and the other side as well. Okay, so full range of motion. Your motion is smooth and controlled. So I'm going to test the resistance of your neck strength, okay? Turn your head to the right against my resistance. Turn it to the left against my resistance. Okay, good. Cranial nerve 11 is intact. So I'm going to palpate your lymph nodes, all 10 of them, starting from your preocular lymph nodes. Okay, your preocular, your posterior auricular, your occipital, submandibular, submental, lastly, your supraclavicular. Okay. Nodes are not palpable. So I'm going to assess your trachea right now, okay? Your trachea is midline. Okay. I'm going to palpate for tracheal shift. Okay, the space is symmetric on each side, okay? So I'm going to palpate your thyroid gland. Okay, no, they're symmetric on both sides. Oh, non-palpable, excuse me. So I'm going to inspect your anterior chest, okay? Breathe in for me. Okay, breathe out. Okay, smooth chest expansion. I'm going to go to the back. Breathe in. Breathe out. Okay, also smooth chest expansion on the posterior chest. I'm going to listen for your breath sounds, okay? First, I'm going to do your anterior side. Okay, so your breath sounds are even, and out of the tissue cells, none were present. I'm going to do your posterior now. Okay, same, your breath sounds are even, and there were no active tissue cells present. Okay, so let me look at your posterior. Okay, so your AP diameter is less than 10 verse diameter. That's good. So the skin color is consistent with another background, and no lesions are present. So can you lay down your back, please? I'm going to just move your glasses like this. Okay, it's okay. Okay, so I'm going to listen to your heartbeat and your aortic first, then your pulmonary, and your Erb's point, tricuspid. Okay, good, and now mitral. Okay, rate and rhythm are regular, and there's no extra heart sounds or murmurs. So I'm also going to auscultate your aorta, renal, iliac, and femoral artery. Okay, there's no bruise present. So I'm going to also look at your abdomen, okay? I'm going to look at your shirt for a second if you don't mind. Okay. So I'm going to start by, let me start by listening first. I'm going to auscultate first. Okay, so your vowel sounds are normal active, that's good. So I'm going to palpate your abdomen. I'm going to do a light touch first, and a deep touch now. So now I'm going to palpate your liver. Okay, it's not palpable. Can you take a deep breath? Your spleen is not palpable. There was no muscle guarding or masses present. Now I'm going to percuss all quadrants. Okay, so there's tympany throughout. A bit of dullness on the right intercostal margins, and liver span is about 9 centimeters. So I'm going to test your hip motion right now since I have you lying down. So I need you to lift your leg up. We're going to do your right leg first. Okay. Now I need you to flex your foot. Okay. So I need you to turn your foot in, external rotation, and now out. This is internal rotation in and out, external rotation. So now I'm going to test your strength for your right leg, okay? I'm going to put your leg up, and I want you to resist against my... Okay, good. Now I'm going to bend your foot, flexion, and resist. Okay. So now we're going to go to your left leg. I need you to put your foot up in the air, straight. Okay. And now flexion. Okay. Internal rotation and external rotation. Okay, now we're going to do the strength up again, okay? Push your leg up, straight, and I need you to resist it every time. Okay? And flexion, resist. Okay. So you can sit up now, okay? So I'm going to inspect your jugular venous perception. So turn your head to the right. Okay, now to the left. No jugular venous perception. So I'm going to inspect your fingers for your capillary refill, okay? Capillary refill is less than 2 seconds. So now I'm going to palpate your pulses, okay? So I'm going to start with your brachial pulse on your right arm, brachial pulse on your left arm, your radial pulse on your right arm, radial pulse on your left arm, your femoral pulse on your right leg, your right thigh, femoral pulse on the left, your popliteal pulse on the right, popliteal pulse on the left, your dorsalis pedis pulse on the right and on the left, and then your posterior tympanic pulse, right and left. Okay, so each pulse had a grade of 2 plus, and they were all equal but bilaterally. So I'm going to do some neurological tests right now, okay? I'm going to test for rapid alternating movements. Okay, so I want you to put your hands flat on your thighs, and then I want you to turn on your palm, with your palm facing up. Okay. Keep on doing that movement and try to go faster. Okay, you can stop now. So your rapid alternating movements are done with equal turning and quick movement pace. So I'm going to do the finger test, okay? I want you to close your eyes and stretch out your arms. So touch the tip of your nose with one arm, with your index finger. Now switch back and forth. Okay, so this is done with accurate and smooth movement. So I'm going to test your sensory feeling. Say when you can feel this in your skin. Okay, so the patient can test like touch. So I'm going to test your reflexes. Okay, so we're going to start with your biceps reflex. Give me your arm, support it. Okay, give me your left arm and I'll support it. Okay, so we're going to do your brachial radialis reflex. So can you bend your arm? Okay. Okay, so we're going to do your left arm now. So your triceps reflex. So we're going to do your patellar reflex right now, okay? Okay, now your other side. And lastly, we're going to do your Achilles reflex. Put your foot in dorsiflexion. And stretch your Achilles now, okay? Okay, give me your left foot now. Again, dorsiflexion. And stretch your Achilles. Okay, normal response occurred with the foot and plantar reflex. So all your reflexes are present bilaterally, okay? So now we're going to do the Romberg test. You're going to stand up, please. Close your eyes and try to stand without swaying. Okay, good. The patient maintain posture and balance. Okay, so I need you to walk in a straight line from your heels to your toes. And turn around and go back. Okay, the person can walk straight and stay balanced. So now I'm going to touch your musculoskeletal system, okay? Can you turn around? I'm going to touch your spine. Make sure your feet are aligned and your back is facing you. Okay, your spine is straight. So there's convex thoracic and concave lumbar curves. Okay, your spine processes are straight and your scapulas are not moving. Okay. Oh, I'm sorry, your scapula is movable. I apologize. So, can you turn this way? I'm going to need you to have this way to the side, please. Okay, it's okay. Forward flexion. We'll put your hands up. Okay, now try to do your hyperextension by putting your hands behind. Okay, so I need you now to put your arms in your back, like this motion. Okay. So also I'm going to test it through strength, okay? So can you put your arms up and try to move against the motion? Okay. I need you to flex your left arm. Okay. And then try to extend it down. Okay, now do the same with your right arm. Flex it and extend down. Okay. I'm going to test your strength. Try to push against my motion. For your right arm, push against my resistance. I'm going to test your wrist and your hand. So can you put your hand on the table? Okay, can you pronate your arm by going forward this way? Now supinate your arm. Okay, place your arm flat on the table, and now place your palms up. Okay, okay, I think that concludes this assessment. You are very healthy, so, okay, thank you for coming in.